For farmers or those who keep cattle, you might have had this experience where you notice a number of them coughing for substantial periods of time, having struggles with breathing, and might even end up dying off, with the observation that the ones that were previously healthy now start coming down with illnesses showing very similar signs. This experience you had just might have been an encounter with a very dangerous bacterial disease in cattle called CBPP, short for Contagious Bovine Pleuropneumonia. It's a respiratory infection that is pretty much common around Africa and its environs, but it is one that you would want to be paying very important attention to because it can cost you a lot in the short term by killing your animals, or even cost you a lot of long-term expenses. You would want to be knowing some important things about this disease and how to manage it. You could protect your animals, your farm, and your peace of mind overall. Now, CBPP is caused by a bacterium, Mycoplasma mycoides, if you care about the name. And it spreads pretty fast in susceptible herds. So assume you have about 100 animals. This disease can spread to as many as 70 of them and end up killing as much as 50 if it's visiting you for the first time and you do not attend to it medically. A common oversight, however, I've seen with people having to have managed this condition is the fact that it responds pretty fairly to antimicrobial therapy. So the thought that, oh, administer medication for a couple days and then the animal that was previously ill recovers and no longer shows clinical signs, the battle against that infection has been won. But far from it. CBPP has a thing of hiding within every animal it infects, such that there is a high possibility that that recovered animal is a very potent and active carrier of this disease pathogen and can very easily pass it on to the healthy ones, either in cases where it sneezes or coughs into the air and the healthy ones breathing that, or the healthy ones have direct contact with the urine or fetal membranes from the infected one. An important thing also to note about CBPP is the fact that pregnant animals, that's cows now, whether the ones that are presently dealing with the infection or that have recovered from the infection, there is a high chance that they pass down this inheritance to every single calf that they bear. Worthy of note is the fact that for CBP infections, the signs you find in grown or matured animals can range from sudden death without any warning aside fever, or in acute cases you can have signs of fever, loss of appetite, loss of body condition, difficulty with breathing, coughing, especially when they have been exposed to an activity that was somewhat exercising. You just see the affected ones separate themselves under a shade and like extend their forelimbs and stretch out their neck. You just notice this struggle that goes into breathing, and you can hear it even from the sound that they make on expiration. Whilst in the younger animals, you are likely to find those affected with CBPP have a lot of reluctance to move because this disease expresses itself in them more along the lines of arthritis. So it affects a lot on their joints. You could watch out then for respiratory distress in the more mature members of the herd and arthritis in the younger members, likely to point you to the fact that you just could be dealing with CBPP. On opening or carrying out postmortem examination on animals that died as a result of an infection with CBPP or slaughtering those that were previously infected, a common find is yellowish fluid accumulating within the chest cavity where you have the lungs. You just see these large volumes of yellowish fluid. Sometimes you could have yellowish material just going over the lungs. You could also find a case where the affected lung, because CBP usually restricts its activity to just one of the two lungs, you could have that particular lung taking on a solid and a heavy appearance where it starts to look more like liver tissue than the lung. So you could see sort of that discrepancy between the pinkish coloration of the normal lung and the CBP affected lung that takes more of that dark brownish color, which on being cut you find this very interesting marble-like design on the cut surface. This change in the healthy lung tissue as a result of reaction of the animal's body to CBP causes that part to not exactly be able to function properly in respiration. So you have this change in the lung tissue coupling with accumulation of fluid within the chest cavity just cripple the whole respiratory condition, and it's sort of like the animal drowning in its own body. It is not exactly a pleasant condition for the animal. You could also find cases where, as opposed to the normal free movement of the lung within the chest cavity, on opening you find sort of like attachments between the lung and the chest wall, sort of like when you have meat sticking to the sides of a pot. Our ability to identify the presence of this disease pathogen and then take actions to prevent its spread to the healthy ones is a good feat, but our goal is preventing its entrance into the herd entirely. We'll be moving on to talk about a couple preventive and control measures you could put in place to curb the deleterious effect of this condition. But before we move in that direction, you could do well to leave a like if you've learned a couple things in this video so far. You could also leave questions in the comments or share an experience you've had with managing this condition. Moving on to talking about how we could exactly prevent this condition. The first and the best option we have is vaccination. Vaccinating every single member of the herd. You could make a plan with the vet to ensure that this is done properly, because it's sort of like giving your cows guns before the enemy even comes in the house. This would save you a lot in the long run. You would want to avoid that temptation of cutting costs by not vaccinating, because what you would spend on vaccination, you would most likely spend that and even more in managing this condition when it comes in, with the added risk of it possibly dying or just the long-term effects that come with this condition. You don't want to have that, because the productivity burden that this disease brings is the decreased milk volume for dairy animals, which is not advantageous to the farmer at all, or the loss of weight and slow growth that comes as a result of the activity of this disease on the body condition of the animal. Not to even talk about those that just die of, causing you losses that are beyond what you would want to bear. Another thing to want to avoid is the temptation of cutting costs by doing the vaccination yourself or getting someone who is not a professional to do it for you, because the chances are that you would not exactly get the vaccination procedure right, and you end up having to face the same condition you were trying to avoid in the first place. So trying to cut any cost in any way with respect to this vaccination is like a gamble. It is an evil road with a sad ending you really do not want to go on. It would also be wise to avoid immediately incorporating into your main herd animals that you just newly acquired. Quarantining them for about a month or more to see if they develop any clinical signs is an additional way of wisdom you would just want to work on, so you do not incorporate a disease from somewhere else into your herd that you have been preciously managing. You would also want to control how exactly your animals mix with animals from other places, either at markets or grazing areas. But this might not exactly be the easiest of things to control, so you just would want to be sticking very tightly to the option of vaccination. It's just something you do once a year. If, however, prevention is not exactly a route you can tow because the infection is already in your house, a thing to do for areas where you can even consider treating is separating the sick animal so it doesn't end up infecting the healthy ones, then treat. If you're within Africa, that's an endemic region, you could go for that option. But the mistake has already been done. An advice I would give is, despite treating, as much as possible, treat that recovered animal as a suspect, because it is very much likely a terrorist that can cause you a lot of problems. So separate the sick one, carry out preventive measures on the healthy one, and I would also advise starting to make plans to sell off the infected one. Yes, selling it off. That might not exactly be the plans you had, but it will be in your best interest, because this guy can cause a lot of problems for you, especially with newly added members to the herd. So if you keep these terrorists, they are likely going to be a source of infection to the newly born animals, or in a case where this animal that is infected is a cow, you do not want to have it producing animals for you, because those would come with the infection from the womb, and you do not want to be having to manage this. So it might not exactly be in your advantage cost wise, but on the long term, it would be in your best interest to consider selling off this animal for meat or something else. Yes, CBP does not affect humans, so you would not be exactly doing a wrong thing to sell it off for slaughter or similar purposes. Lastly, someone just might be asking that, oh, doctor, I have this condition presently going on in my farm. What medication can I administer? The thing is, not for any reason am I trying to hide that information, because you could get anything you basically want online, but I do not recommend you trying to attend to your animals yourself. Get a professional to do that for you. Reasons being that there are a couple other conditions that show very similar signs like CBPP does. For example, we have hemorrhagic septicemia or acute bovine pasteurellosis. So you just might not be entirely certain that it is CBPP. You don't want to be treating an infection you are not certain of. So get your vet to confirm that this is the infection and then tell you the most preferable medication to go for. Secondly is the fact that this particular animal in question might not be battling only with CBPP. Diseases do not exactly take turns or ask permission to affect your animal. So a couple things can be going on at the same time. It might even be very positive that the animal is actually down with CBPP, but you do not want to be just treating one condition and then being at peace because I already have this treated. Then the untreated condition ends up causing you a lot of problems. You do not want to have that. So get the vet to do a proper full diagnosis and let you know the exact conditions affecting the animal, then treat accordingly. Lastly, even though it's certain that you're dealing with CBPP alone, you just would be wanting to involve a professional because a couple things could go wrong. You could do improper dosing of the medication, you could have administration to a wrong site, you could have improper methods of administration that could cause you a lot of problems that just complicates the issue, getting your hands into things that you were not exactly supposed to be involved with. Please get a professional to handle disease conditions in animals. Overall, what would be the important take from this video is to vaccinate your animals against CBPP. This is done just once a year. It's not exactly an expensive process to go through. Just get a vet to sort out a plan for you that works and get it done with your animals. Will thank you for it, and you would also have your peace of mind. If you found this video helpful, you just might be wanting to share it to someone else. This information could be saving someone a lot of cost and trouble. So stay safe and keep your animals safe.